Great. Andrea, do you want to kick us off?
Yes, thanks, Emily. So good morning, everybody. Thank you so much for being here today. We're really excited to present this incredibly important topic that I know here at the Colorado Wellness Center for Girls that I'm consistently working with parents and providers on. So thank you so much, everybody, for being here. I don't know who's in Denver, but I'm super excited to see the sun out today. After a couple of days, we get a little bit grumpy around here when we have excessive cloud coverage and rain. So I know everybody's relieved and happy to see the sun out today. So thank you for joining us today as well. So my name is Andrea Philleo, and I am the founder and the executive director of the Colorado Wellness Center for Girls, which is a comprehensive day program. We work with adolescent girls between the ages of 12 and 21 who are struggling with depression and anxiety and the everyday challenges of adolescence. So this topic for today, enabling versus supporting your child, is one that is very near and dear to my heart professionally, for sure. And I know something that is really important, not only to parents, but to providers and any programs that are working with adolescents. So thanks again for being here today. For the first couple of minutes here today, I just wanted to welcome you to the webinar. Really the purpose for today is helping us break down an understanding of what is enabling behavior versus supporting your child, how we can recognize the difference between both of those. And once we understand the difference, how we can use some practical tools and advice to breaking the enabling behavior, which sometimes prevents us from getting our kids to do what they need to do. So we're hoping to give you some very practical steps that you can walk away with today to help combat enabling behavior. If you have specific questions along the way, we recommend that you put them in the chat. Emily will be doing a very detailed job of checking that chat along the way. So as any of our panelists are speaking, if you need clarification or have an additional question that relates to that topic, please let us know and we'll do our best to address that. I'm also hoping to have some time at the end of the seminar that we can follow up as well, where people can have an opportunity to have some interaction and discuss the topic in a little bit more detail as necessary. So Emily can always flag me when things come up in the chat, and I will do my best to address the panelists and answer those questions. So this webinar will also be recorded. So for whatever reason, if you need to jump off or if you feel as if somebody in your world could benefit from hearing this, please reach out to us and let us know. It will be posted on the Colorado Wellness Center for Girls website, which is cwcgirls.com. But you can always email me directly at aphilleo@cwcgirls.com. Which is also on my website, and I'm more than happy to send you a copy of the recording as well. So I want to say a warm welcome to my four panelists today. I know this is a super busy time for everybody, so I deeply appreciate you taking the time to be here today. So Jasmine, I'm going to go ahead and start with you. If you could introduce yourself, your name, where you work, and kind of how you're involved with this topic, that would be great.
Great, thank you, Andrea. So I'm Jasmine Narayan. I'm a psychologist and co-founder of Create Outcomes Psychological Services. We have 3 locations, 2 in New York, and then also 1 in Colorado in Denver, run by our wonderful team out west. I specialize in working with kids, teens, and parents. I find myself working with kids and teens who struggle with depression, anxiety, ADHD, often that can overlap with anxiety and depression. And I work really closely, both in individual work and family work, in helping parents sort of connect with their child, bond with their child, and sort of reduce problematic behaviors and increase connection and function at home. Yeah.
Thank you so much for for being here today.
Thank you.
Marlys, I'm going to hop over to you.
Hello, everyone. My name is Marlys Woods. I am a board-certified music therapist, as well as a very soon-to-be licensed marriage and family therapist. And I own a company called Get in Tune Music Therapy, and we provide services to treatment centers mostly. We also are starting to take individual clients, but we provide a group music therapy experience where we work with teenagers as well as adults. And our whole goal is to help them to be able to express themselves and teach them how they can use music to communicate with their loved ones about what's going on, especially in this idea of enabling versus supporting when the kid can't open up, or even the adult can't open up and let the family know what's going on to collaborate and communicate. We really work on using music to help with expression. And so we work, as I said, in treatment centers mostly with teens is our main group right now. So that's why I'm here and happy to be here. Thanks for having me, Andrea.
Thank you so much for being here. Melissa.
Hi, everybody, and thanks again for having me. My name is Melissa Westerman. I have a master's in social work and about 24 years of experience in the field, predominantly with teenagers, parents in crisis, the past 10 on the Colorado State Crisis Hotline, navigating conflict and crisis for clients of all ages. A lot of them are teenagers. I started my own company called Reset Coach Support, which is slightly different than a therapeutic approach. It's a little bit more of direct conflict resolution. I specialize in mediating between teenagers and parents on behavioral issues, emotional issues, and communication strategies to help them bring them together through these crisis times. I'm very excited to be here. I was one of those highly conflicted teens, and that's what brought me into this field. So I have personal and professional experience to bring.
Awesome. Thank you so much, Melissa. And Ashley.
Hi, everyone. I'm Ashley Kleinman Martinez. Here in Colorado, I'm a licensed professional counselor. But prior to that, I spent over a decade in New York, where I'm also a licensed creative arts therapist, and nationally, I'm a registered drama therapist, as well as a board certified trainer of drama therapy. My experiences that I've had thus far is pretty varied, which includes working with teens and adults and families and inpatient psychiatric programs, as well as intensive preventive programs. And currently I'm working for my practice that I founded called Brave Space Counseling and Wellness, where I see clients as young as 4, as old as middle-aged, where my focus is helping people who maybe aren't quite able to feel safe because of maybe past trauma or any other circumstances, to find a sense of bravery and empowerment to lead them to a place where they're feeling safe enough to express themselves and move through the world. I do specialize in trauma, anxiety, and self-esteem and family therapy. While I do work with all of those ages, I definitely prefer the kids and adolescents to use creativity to create a mutual language so that we can meet the client where they are, and then to bring the family together to create their own mutual language and understanding.
Awesome. Ashley, thank you so much. So I'm going to go ahead and kick us off here. I'm going to spend about the next, about 10 minutes giving a brief introduction and setting kind of today's webinar in some context here. So the first thing I want to address is that I think enabling versus supporting can look very, very different depending on the kid that we're working with. So some of these tips and some of these interventions we're going to need to tweak based on the type of kid that you have on your hands. So not all things are going to work for every type of kid. There's no magic bullet that we can tell you here today that says, if you do A, then B is going to happen. We can certainly help guide you and help educate you on what we believe is most effective and works well with enabling versus supporting, but you know your kid best, and only you know what your kid is capable of and where they sit at the moment. So enabling versus supporting can look very different when you have a child that is struggling with depression and or anxiety. So enabling takes the form of really us inadvertently, not consciously, inadvertently reinforcing an undesired behavior. So lots of times when we have a kid that's struggling with depression or anxiety, they really believe that there's things in their world that they're not capable of doing, whether that's getting out of bed, brushing their teeth, coming down to the dinner table, getting their homework done, taking the dog around the block. All of those things look very, very different when we have a kid that's hurting. And so what we want to do is to be able to work with the depression and anxiety and help that kiddo problem solve through the hurt, versus giving in and allowing us doing things that we know that our kid perhaps is capable of doing. So let's talk a little bit for a minute about what enabling is. So enabling is what parents do to help often spare their children. Sorry, I just lost my sentence there for a minute. From the everyday heartaches that often can occur as teenagers. So sometimes when we have a kiddo that's struggling, we feel bad or guilty about that they're hurting and struggling. So we will take on and do things to alleviate the immediate pressure that our kid is feeling, thinking, well, if I can just do this for my kid right now, maybe I can get them to do the next thing. Or I'm feeling so badly that my kid is feeling badly that I'm going to make some decisions on their behalf to take the pressure off of them in the moment. So enabling is very well intentioned. So I don't want us to feel bad or guilty when we're engaging in enabling behavior, because it's often, especially as parents, something that we actually think that we're doing that is helpful. But we don't want to protect our child too much. We want to send the message to our kids that they are capable of doing things in spite of not feeling well. So how depression and anxiety work is that, especially anxiety, is that it loves avoidance, right? Anxiety does not want you to engage. It wants to sit in its own little world of taking control and power over a child. And how it does that is convincing a child that they cannot get things done. And so the more that we accept that, the more that we give into that bully of anxiety, the more that it sends the message to our child that they are in fact incapable or can't manage what they're expected to do every day. So we want to be very cognizant and very aware of how anxiety works. And how anxiety works is that it likes predictability. It likes certainty. It likes knowing that everything is going to turn out as planned. And one thing that we can do as parents is educate our kids like, hey, kiddo, I don't know exactly how this is going to turn out. If you show up at school, you may suffer some anxiety. You may feel uncomfortable. There may be a situation that comes up that makes you feel super anxiety ridden and gets that heart rate up. And I'm going to help you problem solve that. But by allowing them not to step into the circumstance or the situation that is anxiety provoking is really doing an enormous disservice to our children. So common examples of enabling behaviors that are most exhibited by parents is constantly making excuses for your child, why they can't get to school, why they can't get off their phone, why they can't come downstairs for dinner, that they're too tired, they're incapable, they just can't manage it, or the anxiety or the depression is too extreme. Completing homework assignments for your child that they're capable of doing. Again, this sends the message to our child that they don't have the ability to problem solve and figure out how it needs to get done. Our kids are not going to be able to rely on us forever. So our job as parents, particularly in the teenage years, is to problem solve and collaborate with them to help figure out how we can help get things done. It may not seem like it in the moment because a lot of kids may put up resistance. I don't want your help. I can't do it. Leave me alone. but I want you to be able to read through those messages that your teenager is saying to you and identify that what they're really saying are things like, I'm scared, I'm overwhelmed, fear of failure, I'm not sure if I can do it. And they are really leaning on you and depending on you to help them figure it out. So when we back off of that, or we enable them to not do what they need to be able to do as a teenager, we're really not giving the kid really what they need in terms of strong boundaries. Each of us as parents need to identify our own limits. And once we identify those limits, it's really important that we stick to them. So once we hit a boundary within ourselves, or we identify a limit within our children, we need to have the capacity and the strength to hold that limit. And we're going to be talking a little bit today about flexibility, when you always hold a limit and when you always hold a boundary, versus when there is some breathing room and flexibility in that process, depending on the circumstances. And part of this process is being conscious as a parent of knowing what our value system is and what our expectations are of our children and in what they're capable of doing. Giving in to whining and temper tantrums. So we all know the lovely story of us parents in the grocery store when our kid throws a fit because they can't get the toy or the piece of candy that they want, and the importance of an adult standing their ground in that situation. So we can identify the emotions around that. I hear you're frustrated. I hear you really want that toy. You think it'll be a lot of fun to play with. Maybe a kid your own age has it and you saw it at their house. But we're really trying to get the kids to open up and express their emotions about what they're feeling versus giving into the behavior or the demand. And that holds true with adolescents as well. When they're whining and when they're throwing a tantrum and getting dysregulated, our job is to stay regulated. Our job is to be that strong oak tree in the room that says, hey, I get you're feeling A, B, C, or D, but I'm going to still ask you to try and express your emotions and ask you to do what I'm asking you to do and follow through. And lying on behalf of your teen so they can avoid punishment or consequences for their actions. So this is super easy to do, to make up excuses for why things aren't getting done. But as we know that the only way that our teenagers can grow and learn is actually by hurting and living through the consequences of their behavior. And sometimes this is really hard to manage and watch as a parent, because we know as adults how difficult those consequences can be. But when we step in and we avoid or deter those consequences from happening, there's not a lot of learning that takes place on the behalf of our teen. Supporting, to me, is really about helping our kids build up resilience and the capacity to problem solve. And they need our help with this. So collaborative problem solving with parents is super important. And to me, that defines what healthy support is. We always want to empower our kids to move forward, for them to be able to make the best choices that they can, and to be able to lean on us for support, but not always depend on us to do the work for them. So there's a big difference between us guiding them and helping them and us actually getting something done for them that actually takes away from their ability to empower themselves. We always want to model healthy coping skills. That's a big part of the support system. If they can see us regulated and calm and trying to figure out a solution to the problem, the better off the outcome is going to be. We also want to be able to assess fear, and we're going to be talking a little bit about what it means to be operating from a place of fear as parents and how we can support ourselves in the process as well as our kiddo. So with that, Emily, I'm going to go ahead and ask if there's any follow-up or questions about that before I move into the panelists.
No questions yet.
Okay, awesome. So Jasmine, I'm going to go ahead and get started with you. Something common that's very coming up for us, I know in our work at the Colorado Wellness Center for Girls, and I think with a lot of practitioners out there in general right now, especially given COVID, is that parents are having a very hard time motivating their kids. Getting out of bed, turning on their computers, getting their work done. We know that this year has been hard. And this can be a really muddy and tricky situation. So how do you think, parents can differentiate between their child needing a break and a mental health day versus not allowing your kids to avoid what they need to be getting done? So how can we help parents avoid the avoidance mindset and help parents support their child in getting them up in the morning, getting them engaged in school, and helping them focus and get plugged into what they need to do for the day?
Okay, yeah, that's a good question, Andrea. So let me start with just talking about a mental health day, and I think that's such a great idea. I think it's so important right now because it can really help us teach our teens how to advocate for what they need, how to take care of their emotional well-being, how to take care of themselves, and balance those needs with all the other pressures that they're dealing with at school and sports and social issues and things like that. So I think the idea of a mental health day is really important, and it can be very valuable. And I think the best way to differentiate between a mental health day versus an avoidance day is to look at the purpose, right? So a mental health day would be intended to help reduce or manage stress, to give the mind and body a break, a rest, a chance to recharge, to rejuvenate, with the intention of, with that break, I can sort of tackle the next day. I can go into the next day feeling a little bit rested and taken care of. And that's a really valuable purpose. With avoidance, the purpose is not going to be to rest and rejuvenate. It's going to be, it's to escape, really. I don't want to deal with the things that I have to deal with, the things that are on my plate. A test coming up, maybe there's some social issues going on at school that are causing low self-esteem or causing anxiety and depression. I'm just going to put it over there, and I'm going to be here at home, and I don't have to deal with any of those stressors. And I think parents can know when it's avoidance, when you see, your teen being stuck, worrying about the worst case scenario. They might have physical complaints. You might see stomach aches, difficulty sleeping, reduced eating, the signs of depression and anxiety. And I think one way to help your teen navigate it, so my next set of advice is with a caveat. It's not going to happen overnight, right? Your teen's not going to wake up and, okay, let's do mental health days, and then suddenly they're going to stop avoiding the stuff that they're avoiding. That's not going to happen. It's going to happen over time as there's increased communication between you and your teen, and sort of navigating together and understanding together, okay, when is a mental health day appropriate? And did you take a mental health day, but actually it kind of turned out to be you were actually avoiding, and that information came a little bit later, and that's okay, because it's a learning process. And the teen, to empower them, they have to learn how to recognize the signs in themselves as well. And your role as a parent, our role as parents, is to help them navigate. So I think building on something you were saying, Andrea, about collaborative problem solving, is a great way to do this around mental health days. So where you can communicate and collaborate with your teen is, all right, what is a mental health day? How are we defining that? Right? What is the purpose of that? How do you know when you need one? What's an appropriate amount of mental health days, right? Negotiating with them. It's not going to be every day, right? Or if your teen's doing a little bit better or further along, or anxiety and depression is less right now, they might not need as much. But if they're really struggling, and basic things like getting out of bed and eating and brushing their teeth, they're probably going to need more. And sort of helping your teen understand, okay, because you're struggling, this might be a greater need right now. And so there's more days built in. And what does that look like? And then also communicating with them, how do you ask? How do you know and how do you ask? So they might wake up in the morning and go, I need a mental health day today. And you're not sure if it's avoidance and you're not sure if it's self-care, but you can communicate and sort of work through the moment together. And you can ask questions like, okay, today's hard. I can see that. I can see that you're needing a break. So help me understand, what is your need today for a mental health today? Why today? You know, okay, mom, I've been studying for this test and I've been having a lot of sleep and a lot of anxiety, and I'm not, you know, I haven't slept well in 5 days, and I just need to rest. So rest becomes the need. Okay, so rest. And then talking to your child. So I hear that you need rest. What's your plan to get that today? So rest isn't, hey, I'm gonna sleep till 5 in the afternoon. I'm not getting out of, that's not rest. That's not restful, right? Rest is, I'm gonna sleep in. I'm gonna give myself that. I'm gonna sleep until noon. And then I'm gonna get up and I'm gonna do more restful things. And whatever that might be for your child, you know, I imagine they would be, that could be something that could be worked out with the supportive in therapy as well. Right? What does rest look like? Is it doing something creative? Is it taking a walk? Is it having a bubble bath? Whatever their coping skills are. But I think having that expectation in the beginning, when your child asks for a mental health need, a mental health day, sorry, and be like, okay, this is what we can expect for the day. So your other question, Andrea, was like, so what do we do when it's actually avoidance?
Yeah.
Right. So once, if you come to find out, or, you know, I mentioned some signs of anxiety, it starts to become a pattern. It starts not to look restful or self-care. It starts to look more like, I can't get out of bed. I think in these situations, when things get really bad, it's really hard for any of us to not get lost ourselves in what's not going well. You know, what the problem is, we get lost there. We tend to focus on that. And it's hard as parents to watch our kids struggle, and we just want to help, right? So it's hard to watch kids struggle. And, but I think trying to, as parents, pulling ourselves out of what the problem is and what the child is not doing, and trying, even if it's a small shift, starting to look at, okay, what is my child doing? What are they actually doing? So let's say my child woke up late, couldn't get herself, it took forever to get dressed and ready, and she missed the first 2 periods. Instead of getting stuck in what she didn't do, what did she do? She was able to get herself ready for 3rd period. Okay, that's something. I would even ask, you know, a teen, okay, you got yourself to 3rd period. How'd you do that? And even helping the child focus in on, instead of what I didn't do, and letting them beat themselves up, because most kids don't want to not do good. Most teens, they have an idea of how they want to be successful. They don't want to do badly. It creates guilt. So even helping them shift to how they did, how are they able to make the step that they did, and how do they get there? And then working with them to sort of build on that a little bit more.
Yeah. Go ahead. No, go ahead.
No, I think that was, well, I guess one thing I would add here is, I'm not saying, you know, you say, good job, you got to 3rd period.
Right.
Stay away from these like general good job. I'm not talking about praise here. I'm just talking about acknowledging effort, acknowledging small things, training ourselves to look for the ways that our child or teen is able to be successful for where they're at, and helping them see that, helping them tune into, okay, maybe I wasn't able to do X, Y, and Z, but I did do this today, and build on that. Yeah.
It sounds really strength-based, right? Instead of focusing on what they can do, focusing on what they did do, even if it's not fully what we expected them to do. So I really appreciate you bringing that up. One thing, you know, I wasn't going to go in this direction, but I'm going to now because you said it, is this, I think we underestimate how guilty and bad kids feel about not doing what they're expected to do. Somehow we have this in our mind that they're just apathetic and they don't care and they're selfish and they're like, you know, screw everybody, all I care about is myself. But that's not my experience at all. in working with teenagers. My experience is that they're internalizing this and indeed feeling very guilty, and indeed feeling very guilty about causing conflict, about causing strain, and about causing their parents to also be hurting in the process. So I'm really, I'm so glad you brought that up, because I don't think that they want to feel bad. I think if it was their choice, they wouldn't feel bad. And I think they feel bad about feeling bad.
I completely agree. I haven't worked with a child or teen with anxiety and depression who really, where it's coming from this a lazy or an entitled place. It's really like, I do want to do well, and it feels like heavy to be able to just do anything. Yeah.
Yes. And one quick follow-up question. So if you're not getting your kid out of bed and there's a lot of resistance there, walk us through a little bit about, you know, your example was a kid that could, you know, kind of open up and describe their feelings and say, hey, mom or dad, I'm feeling scared or afraid, or this is what's going on in school, or I have a test. And then we can work with the emotion that they're feeling and try and help them move through that. What is your suggestion around a kid who's, you know, covers over their head, yelling and screaming, get out of my room, I don't want to talk, leave me alone? What about that situation? What would be kind of one tip that you could give in that scenario?
Yeah, so I think in that situation, you know, what you want to avoid is a power struggle at that point, because you're not going to win. You can't carry physically a teenager out of there, pull them out of bed, and what's going to end up happening is the intensity behind which the conflict of a power struggle is just going to overtake everything, and it's going to make yourself feel worse as a parent, and then it's going to make the teen feel worse for all the things we just talked about, what they're not able to do and what they're causing for you. So definitely avoiding a power struggle. I've had, in some examples where I've had this, worked with families where this will happen, you know, the parent can go, I suggest parent going in, always starting with reflecting and validating the feeling. I can see today is a hard day. I can see today is I'm not getting out of bed day. And you know, a gentle reminder of what the expectations are today, and that I'm here to help you get through this. Sometimes what I'll have a parent do is actually leave like a piece of paper and a pen, or have a journal or something like that with an open page, where it allows the teen to be able to write some feelings or pass a message under the door or something like that, when they're ready and if they're ready. At that point, you know, if your child's not getting up at that point, calling their support systems at school also, and just sort of helping so that you have support as a parent to sort of problem solve what's going on and what the consequences of that action is going to be for the teen, right? So they missed school, they missed assignments, and you had the information ready for when they do come out of their room, and then you can help them again problem solve. Okay, you missed today, and here's what happened as a result, and let's make a plan for what we're going to do to deal with it.
Thank you so much. That was really some incredibly detailed information, and so much appreciated on what we can actually do and how we can navigate that exact specific process. So thank you so much.
Thank you.
Emily, are there any follow-up questions for that?
Nothing so far.
Okay, thank you. Ashley, this second question is for you. Sometimes parents create an enabling environment by normalizing their child's behavior. Oh, it's just them being a teenager. What are some ways parents can decipher whether their child is doing normal kid behavior or they're actually participating in connection-seeking behavior? And if they do identify this as connection-seeking behavior, what are the next steps to supporting this? And I think you're on mute.
I thought I did that to be more polite. I'm glad you used the phrase connection seeking. It's something I've really tried to shift over the past couple of years versus attention seeking, right? Because that alone can be just like and I don't even like to use the word negative, but it can be sort of this negative label put on someone for attention seeking. But usually if someone is attention seeking, it's because there is a need. There's a need for connection, or even if they do need attention, how can we provide that? How can we provide that connection and attention and by being attentive? And so I work with, like I said, a range of ages in my clients, and some of the behavioral issues that come up are very big, problematic, challenging behaviors. And then in a meeting with a parent, they might be like, well, and she didn't put her clothes in the hamper, and certain things like that. And so when we sort of have these conversations, trying to figure out, sometimes it first is a conversation with the parent. Maybe it's a list of normal kid behavior and more important behavior to address, or maybe it's in a discussion about there are a lot of challenges coming up, but how can we be reasonable in approaching it, right? Especially when there is a child who has a lot of things they need to improve, that we want our goals to be attainable. So with parents, or even in a family meeting, I really like to bring everything and focusing on safety and respect, right? So if a child has a messy room a lot and doesn't clean it up when they're supposed to, like, that can be fairly normal, right? Fairly normal for a 10-year-old. Okay, but are they being safe in their day-to-day life? And are they being respectful, right? There might be some attitude, of course, but if those things are there, then okay. So maybe that's something we can focus on later. But in this situation, they pulled a kid's hood at school because they were just so angry, right? That isn't safe and that isn't respectful, right? And so I really, sometimes it can feel very complicated when we're trying to figure out labels for certain behaviors, just focusing on safety and respect, and then having a conversation with the child. Hey, why don't you clean up your room? I don't know, I don't really care. Okay, it's your room, right? Or if it's similar to what Jasmine was just talking about, I just feel like I can't pick anything up off the floor because I don't have that energy, right? Then that does become something to look at more. So sometimes it is about the task itself, but then other times checking in like, hey, this is an expectation, or this is something that I've asked you to do or not do, but it seems like you have a different understanding, so let's talk about it. I really encourage transparent conversations, right, around having a conversation with the child, because otherwise they know they're being talked about, and then that just feels, it doesn't feel very good to be talked about. They want to be a part of the conversation, especially when they're like 8 or 9 and older. So then if it does appear that there are certain behaviors as connection seeking, right? Maybe they have a certain behavior that they do when their parents or caregivers are at work. Okay, so this is interesting. Maybe this is me saying they need connection with their parents. So I hear that you've been doing this unsafe or disrespectful thing to the babysitter, to your sibling, or to your teacher. It makes me think that maybe we need to spend more time together, right? And so doing something that is sustainable, right? Because we have a pandemic and we have full-time jobs and all of those things, but let's schedule something, right? Whether it's Saturday morning or whenever. And then also in these periods of time, I like to encourage parents to find a creative way to get to know your own emotions and your child's also, right? So instead of just going to a movie, maybe it's, let's draw something together. You draw how you're feeling, I draw how I'm feeling. And then it's a way that you can, the parent and the child can observe each other and find out what they have that's similar and then what they have that's different. And then it can be a way of understanding. It's like, okay, thanks for doing that with me. Now let's go to the park, or let's do something like that. So I'd really start with focusing on just the basics of safety and respect, and then the motivation or lack of motivation, and then validation from there.
So it sounds like, Ashley, that it starts with the parents being able to pick up on cues, being able to sense what's happening, and then being able to ask questions around that, right? So you're probing into what's really behind the behavior. And in all of us, I think behavior is always connection seeking.
Right.
And obviously kids can articulate it or express it as well as adults because they really don't understand themselves, understandably. So helping kids understand the importance of what's behind their behavior. And it really starts with, it sounds like, being pretty inquisitive about what your kids are thinking and feeling.
Absolutely. And I really think, because a lot of times the adult or the parent is supposed to be the expert, but that's actually not really true, right? As parents, it's important for sure to create a sense of safety and structure and consistency and expectation. But the child is going to have moments where they're the ones that are the expert of themselves and empowering them to do that, right? So then as the parent, allowing themselves the moment to say, this is what's going on with me. And then if they don't know, it's helping them figure out what it is, right? So sometimes when there's acting out, it's because they just don't know the word for anger or sadness or melancholy or anything like that. So it's about understanding and expressing. And I think I want to add, there's something I saw maybe on Instagram, but instead of using the word symptom, using the word an indicator, right? So if a child is not getting out of bed, for example, that certainly could be a symptom of depression, but it can feel like a very heavy clinical labeling word, which we can certainly use in our documentation. But in the conversation with the child and the family, how can we use any of these behaviors as indicators for what they need and what we can offer?
Right. Right. All about the connection to them and helping them understand themselves.
Mm-hmm.
And I think if we can model for them, hey, this is the way I'm feeling, or this is the way it makes me feel when these things come up, I think that can open the door as well.
Absolutely. Modeling is so important because if they think that their parents aren't feeling these challenging feelings or the adults around them aren't, then there must be something wrong with me. Why do I feel this, but they don't feel it? So then how can families feel together and move through together?
Right.
We did have a follow-up come through too, Ashley. So one of the questions was, how can parents handle children that truly are struggling with depression, yet at times are manipulative with this? So for example, not wanting to do chores because they are feeling depressed, specifically towards the depression piece.
Yeah. And so I think this is similar to what was talked about before, right? Where first we validate, right? I can see that this is a very heavy day, and maybe the parent and the child can create sort of their own words to describe the depression. These are the expectations for the day, right? And I think I saw it, this is going to be related to a question I'm going to answer later as well. How can we make that happen together, right? So I encourage, sometimes it can be a collaborative effort, right? So if the expectation is cleaning the room and setting the table, maybe a parent can, right, validate and then let me help you start, and then I believe that you can finish, right? And then if it really is something that it's just not happening, then having a conversation about the natural consequence of that, which I believe I'm going to get into later in another question. But to be supportive and to validate, but then also say, but we also have things we have to get done. So why don't we clean our room and set the table, and then after dinner, what would feel comforting for you? So to create a bit of balance.
And so this may be, I'm going to throw this out, and Ashley, you can answer it directly, or anybody else can, the panelists can throw their hand up. So when we've got a kiddo who's clinically depressed, and in your example, Ashley, they do not have the capacity to do what's best of them. How do we understand the difference between feeling in a depressive mode versus a kiddo that's clinically depressed and cannot meet the expectation of what we're asking them to do. So we all know really good treatment modalities for depression. And so in that moment, when you are realizing as a parent, my kid is too clinically depressed to get this done, versus I really think that you can do it in spite of you not feeling well right now. And I think it'll ultimately help you feel better. Where do we go from there? So when we've got a kid who's in that kind of level of a mood disorder, what are our next steps in that situation?
I think the next step in that situation would be, right, if you've reached a point where you encourage and you offer these mental health days and all of these things, and they're still just not getting out of bed, having another transparent conversation with the kiddo of being like, you know, it seems like this is really hard. It seems like you really can't get out of bed. And I want you to do well. And I know you want to feel better. So then what kind of resources can we bring in, right? So then having those conversations about a therapist or a resource center or something like that. And to do it in a way that's about feeling well and moving towards feeling better to get the help that you need, right? Getting out of bed is an indicator that, not getting out of bed is an indicator that you're really struggling. And that makes me feel blank feeling, and I want to be able to help you, but I know as your parent, what I can do is limited. So let's look up, I'll look up 5 therapists, you pick 2 you want to call, right? So that they can be included in the process. Most therapists, I know I do offer a consultation, include them in the consultation, right? So let's call in outside resources so that you can feel better, right? Versus you're not getting out of bed and so you have to meet with this person because it's a punishment.
Right.
And if I can add something, you had said other therapists as well, just also changing your viewpoint. If you notice the way Ashley and Jasmine have talked about this, it's this collaborative thing. It's not, oh, my kid's being manipulative right now. So in the question itself, we already put, when we said the manipulation piece, like we're already putting the idea into our head that it's negative what they're doing and it's purposeful what they're doing. And oftentimes that oftentimes isn't the case. It's just the best way they know how to deal with that emotion. And so if I'm going to approach someone and I think they're manipulating me, right, I'm going to be much more defensive and much more short with them and not really listening to them. But if I can reframe it for myself that like my kid is this is an indicator that my kid is struggling, and then I'm going to be more of a mindset of like, I would like to see if we can figure out if bringing in outside sources is helpful for you, right? So it's just like also that mindset shift for the parents, just kind of also like Jasmine was saying earlier, that most kids don't want to be failing at whatever it is they're doing. Most kids aren't purposefully manipulating you. So just, I wanted to add that.
I just wanted to add something too. You know, I think that one of the most important things that I found as a struggling teen that I use a lot with my teenagers is you have choices. They may not be choices you want, but the choice to lie here for day after day is not a choice that I can allow as a parent because you're suffering. So here are the choices we have, and I'd like to work with you on choosing one of these choices. You may not like it. A lot of kids don't like to go to therapy, especially teenage boys. A lot of men don't like to go to therapy. You know, it's hard to sit and talk about your emotions. So maybe it's something different. Is it, art class? Is it going, going, whatever it is, provide a variety of options, because sometimes it's not just therapy for that child, and that's not the support they want or that's going to help. But the option isn't going to be staying in bed day after day. But we're going to help you, and I'm going to support you, even though you want to stay in bed every day, with these choices. Come up with a couple of them. It's not up to the child to come up with those choices. When you say, well, what would make you feel better? Lying in bed all day and playing a video game. That's not an option. It's up to us as parents to come up with the healthier choices and help them choose one. Because they're empowered to choose one. It doesn't have to be the one you chose for them, but it's a start.
Great. Yeah. And Melissa, I'm going to circle back to you about what you can do also when they're not able to come up with those choices, because I completely agree that it's better and should come from them. So I'm going to circle back to that in 1 minute. Marlys, I'm going to circle into you right now because you just hit on something that I think I'm just going to piggyback off of. So we're talking a lot about creating a collaborative environment so that when big behaviors come up, the connection is already there, the relationship is already there. So in order for us to help navigate these tumultuous waters that our kiddos are going through, our best shot at that is if we can have an honest, already established connection with them. So we talk about creating kind of a game plan around expectations. Like, I get it, and the next time we're not feeling well, we're going to try and do things this way, and here's what I'm going to ask you to do, and hopefully we can work through this together. So if parents can't get their kids to come up with a game plan, and Melissa, you just hit on this as well, Marlys, what other things can we do? So how can we as parents say, okay, so there's some really high emotions here, we're having some challenges coming up with steps to move forward. What can you suggest to parents in terms of kind of now what?
Mm-hmm. I think some of the things I like to do to throw off the focus a little bit, like Melissa was saying, that it's not, this is therapy, like, let's fix you, is obviously I'm the music therapist. So like maybe taking the attention off of it for a second and say like, hey, can I just hear a song that you are really enjoying right now, or that really relates to what you're going through? So then it's like, oh, my parents like interested in me and what I'm going on, and it's establishing that connection. Because maybe right now they can't say to you like, this is what I'm going through, I have the words for this. So maybe it's like, is there a song that might represent like what you're going through right now? And then talking with them through that, right? So the attention's kind of for a second. This is obviously if you have time to do this. This isn't 5 minutes before the kid is supposed to be somewhere. But taking the time to connect with them over the song, and then taking it a step further to help give them the words of being like, you know what if we try and write our own version of this song? Like kind of like Ashley was saying about the art piece, like I'll write my version of this song when I'm feeling this way. And maybe you can write your version of this song when you're feeling the way you are right now. We're giving them that song to help them think about it, give them the words, we've talked through it, and now allowing them to put words to it themselves. So that now as the parent, you can sit there and be like, oh, this is what my kid's going through, right? This is how I know I can help, or I can go ask someone else, my support system of, okay, therapist, this is what they're going through. How can I help them when they're in this situation? So I think that's one of the ideas I would give you of like taking it off of how can we make them do this because they're not doing it right now. Okay, but now they're also not communicating with me when I'm trying to collaborate with them. So what is it something that my kid likes? Maybe it's music, but maybe it's art. Maybe it's let's draw what you're feeling right now. And like Jasmine said, just like put it under the door and I'll talk to you that way. Or even getting creative, like instead of going into their room, sliding some silly thing that you're drawing, like, hey, how you doing? But like in stick figures under the door, right? So taking this attention off of you're doing bad and not getting there, and I'm going to be here to help you. It might be a way for you both to communicate and connect in some more creative ways. Or maybe it's, a sport that they enjoy or something else, but using something they're connected to and can incite a little bit of excitement or energy into them, and connecting with them on that first, and then trying to find ways to bring that into what's actually going on. So if it's a sport, right, maybe like, well, like when you're in the game and you feel crappy or you feel like you can't do it, what helps you when you're in a game and you can get there and you still succeed? So that would be some of the other tools that I would add into how we can like find this piece of connection with your kid. Because like we said, we're looking at it from this connection seeking behavior instead of attention seeking. And so, yeah, that would be some of the advice I have.
Yeah, that's awesome too, because it reminds me a lot. I think parents get super focused on fixing the problem in the moment, right? I got to fix this. I got to make it better. I've got to win, right? We talked a little bit about power struggle, but it's not about winning the conversation. It's not about convincing your kid to do something or not to do something. And that's where I think that a lot of parents get caught, that they think the name of the game or the name of the moment is, I'm going to come out of this and I'm going to force them or push them or convince them to do or not to do something. And that's not really what it's all about.
Mm-hmm. Yeah, I would 100% agree, because when you're in that power struggle with them and really holding on to this view of what your kid is supposed to be and why aren't they acting that way, you're coming from an emotional spot. You're unregulated, and then going at a kid that's already yelling and screaming at you or ignoring you. And so it's just going to be this back and forth. But if we can be like, you know what, today's a day that they're not getting up. Like, I just got to accept that. But how can I help them move forward so that they can get up next time, or they can move forward? Because that the winning is all of us getting your kid to a place where they can function. The winning is not, oh, they went to school today. Like, that's not the win. So really, again, changing that mindset.
Yeah, absolutely. And the last point I want to make with something you also said is, I read about it in a book recently, really bullet pointed, is get interested in the things that your kid is interested in. And so I really like that a lot, because, you know, I have a science-based kid and I'm not a science person, but I forced myself to at least get curious about what he likes. And so this is really important. It may not be your vibe, it may not be your thing, it may not be something you've chosen, but that's where the relationship is built, and that's where the connection is built, because now you're expressing interest in something that they like. And a lot of material that's not content-based, I may not learn about science more, but I can learn more about what my kid is thinking and feeling, which is the whole purpose of connecting, of being interested in what they're doing.
Right. And most kids, especially when they're really struggling, the music they're listening to is rough, right? Like a Little Peep, the music itself is depressing, and then his own lyrics are really depressing, right? And so parents want to get their kids out of that, and they're like pushing them away and shutting down. So if you can make yourself listen to some of this music and see, okay, what could they be connecting to with what they're going through, whatever that is, right? Whether it's science or whether it's this horrible song my kid's listening to that's promoting all these negative behaviors. What is it that I can pull out of that and show them I'm listening? And that's what we do in all our groups. Then we transition that to what is the safety that we can get to? How do we not enable Little Peep, who died himself, but understand where he's coming from and they're coming through, and move them to a safer place? So yeah, definitely, Andrea.
Yeah, thank you so much.
Mm-hmm.
Emily, was there anything related in the chat to that?
Yeah, one of the questions that came up was so suggesting to connect with your child and asking them how they feel during a sport and what makes them feel better. But what happens when your child says nothing and just really isn't responsive to that connection that you are trying to create through the sport or the music or something along those lines?
I get that. It happens all the time when I talk to kids on the crisis line. Nothing. So I start from a perspective, tell me what you don't like. My mom's on my case 24/7. Tell me what drives you nuts. She asks me all the time if I'm fine. Okay, you want that to stop, right? Yeah, it drives me nuts. What can we do to get that to stop? Mom, what do you need to hear from him? So you're coming from a place, if they can't think of something that's helpful, they definitely can think of 5 to 10 things that aren't helpful. So how, your mom's on your back because she's worried about you. You know what, as parents, we're crazy, we worry. What can we do to help mom get off your back? Which usually tends to lead to something that's going to be helpful for the child. Mom, you need to see, I need to hear from him in the morning that he's okay. Okay, maybe he doesn't want to verbalize it. Can he send a text in the morning? Whatever it is, but starting from the place of what they don't like. Because that usually, you got to get the buy-in from them as teenagers, and that buy-in is something that they want. So nothing helps me. Well, then what doesn't help you? And then work from that place.
Yeah. I would definitely always suggest asking the opposite, like Melissa said. And also just realizing, like, if your relationship leading up to this was not to connect with them, and all of a sudden you're like, let's listen to one of your favorite songs, but you've been shooting down their favorite artist for years, like they're not gonna want to connect with you, right? So also maybe just letting them know, like, hey, I'm here. I would like to connect with you. I know in the past I've really shot down A, B, or C, but I'm trying to change and trying to connect with you. Or just like putting on that thing in the background, right? So they can hear that you're listening to it, or that you're, learning about it, and just leaving it, like just coming in for that day and saying, hey, would you like to connect through this? No. Okay, just want you to know I'm here. I know I've been difficult before, but I'm really trying. And then leaving, right? Just maybe it takes 4 or 5 times of that. They teach us all the time. And when you're going to school to be a therapist, that sometimes just sitting with them in the silence, maybe you have to sit through 3 or 4 different sessions where they don't talk to you at all. And I can remember having a client who would just stare me down, just like the death stare every session. She wouldn't talk. She'd be here like this. And eventually I said to her, are you plotting ways to kill me? Like, what's going on in that head? And she started cracking up. And from there, she opened up and started talking with me. But sometimes it's just being there, or giving a little note or a little something that, hey, I'm trying to do different, or, whatever it is.
So Melissa, in that particular situation, do you think that, if you're asking a kid how they feel and they've got nothing, one of the things we want to remember about adolescence, it's kind of like the weather in Colorado. It may change 5 minutes later. So just some psychoeducation on that. Maybe if you got a kid who's not answering, and Marlys, you had some wonderful examples of kind of organically, naturally creating an environment for that to happen. Melissa, anything else on that where you can offer a suggestion?
Yeah, when you think about it, especially during COVID, kids don't communicate verbally, very, very little anymore, to each other, to parents. So their verbal skills aren't as high as how ours grew up. So here's an example. So I had a teen who was highly suicidal all the time. Parent was losing it, which is understandable, terrified every day. They were not, he refused to communicate. You're driving me nuts. She's more scared because he's not communicating. I said, hey, how about this? Your mom's got to get off your back. I know you say you're good. She's worried. Every morning, will you send her a text? And I won't do the whole assessment, but it's a suicide assessment, 1 to 5. I'm at a 2. And if I need something, here's what I'm going to do. That's all you need is a number. Mom, you have to believe that this number is true, so you're not constantly asking him. That is a much better way. He was able to do it. He doesn't have to talk about his feelings. It's a number. Because, your mom can't live in this space where she doesn't know how you're feeling. I'm sorry, that's kind of what you want, but that's not going to happen. You don't want her asking you, how are you feeling every morning? Going back to their style of communication. It's not letting him get out of the fact that he cannot communicate. It's his style of communication that she could be okay with. But again, as a parent, you have to say, I said to her, truly, will you be okay? Because if you get a 2, are you going to follow up in his room? Well, how are you feeling? That's not what he needs right now. Can we've worked around that a little bit more, but it was, you can't not communicate to me how you're feeling. I can't live like that. But it was in a style of communication that was comfortable for the kid.
Yeah.
Because it's not letting him get out of the behavior. It's tweaking it around what's going to work for both people. Again, the buy-in from the teenager and the buy-in from the parents is the most important part. Because if you do something, as we all know, you're doing this, if you aren't bought into it, especially as a teenager, it's not going to happen or be effective.
Right. And it's also minimizing and taking away that power struggle. Right. So Melissa, you've been working on a crisis line for quite some time now. And so I know you've seen patterns of enablement that have been embedded for years. Right? Years and years enablement has happened, and now people are calling you in crisis, asking you to untangle a very messy, complicated web that's been created. So in your work, what are some of the things or suggestions that you're giving to parents to help decrease enablement and shift it to more of a supportive environment?
I think the best way I can describe it is by giving examples. This is a brief one, but I had a mother of a 38-year-old that she's enabled her entire life. And it's not working well for that 38-year-old because it doesn't. You as a human being, when you leave your parents' home, there's no one enabling you at work. There's no one enabling you in the world. And that's a very hard reality for a kid who's been able to manipulate their environment and had enablement done their whole life. It's a horrible place. Of course, mental health things happen. Their world's falling apart because people aren't working around them like it happened at home. So for example, I had a 12-year-old call the other day, very anxious, very upset. She always hates her teacher, and her parents have changed schools twice. And the parents called to talk to me first saying, I think we're going to change the school again. I said, okay. you're changing the environment instead of addressing the issue, because she could probably go to any school and going to have this issue. So instead of dancing around taking the problem away, we got to address the problem. So they're like, well, we do that, you know, we know she's, another example of this child was she's on her phone. We have rules for it past 10 o'clock. This is a 12-year-old, but we know she's been up till 2. And I said, well, why don't you have the phone then? Why are you still allowing this? We're afraid of upsetting her. And I said, okay, can we reflect on that a minute? She's 12. You have set rules that the phone needs to be done at 10 and she's on, but you're afraid of upsetting her. And this brought reflection to him, like, you're right. I said, she's 12 years old. That is not her decision, nor does she need it to be her decision. That's yours. So we started to touch on that and it began to start to look at this. I got the child on the phone. And what I like to do is I validate first. I hear you. Gosh, that sounds awful. Wow, that's got to be a real struggle to have a teacher that you think hates you so much. You validate. You know, we're empathize. I understand that's hard. So you're not dismissive about it. I empathize with her. But you know what I said? I started empowerment. You're a really good student. You're going to let this teacher run you out of school? You're stronger than that. And we come from a place of empowerment. She's still going to go, and she kept pressuring me, I need to change schools. And I said, well, guess what? Let's say we get to the next one and you don't like the teacher. So let's help you figure this out. We got 2 more months, because anytime you walk into a classroom and you don't like a teacher, you're going to be able to handle it. So it's empowering her. And she pushed and pushed, where she pushed her parents to change 2 schools. She wasn't going to push me, and I empowered her. And she actually, look, some kids don't, but she came around. I said, what can you do while you're in class? What can you think about? She's a straight A student. She says it's boring. Think about where you want to go. Think about what do you like about school. Don't let her take that from you. You're stronger than this. Let's write down these things. So in the morning when that anxiety kicks in, you remember you've got this. She doesn't have control over you.
Yeah.
And that empowerment. And then there's choices. We're not going to change school. We have to go to school. So what can I do to support you with the things we talked about to empower you to go to that school? Because we're not changing schools at the end of the year.
Right. And it's so powerful and it's so mobilizing and it's so motivating. And it also puts the power back into an internal locus of control versus letting the external environment bully you and dictate what you can and can't do. It puts the power back in the person, which is so incredibly important.
And I think it's also what I say to a lot of kids I talk with, and I definitely talk to kids in my own practice and on the crisis line that have reached a breaking point, and a lot of them are manipulating their environment around them. You're not going to get out of the consequence. You got to clean your room. You might tell me you want to kill yourself 8 times if we're cleaning that room, but we're going to get the room clean. But we're going to work with this. We're going to talk with this. We're going to understand your feeling. We're going to validate your feeling and give you some tools and some choices, but that consequence isn't going away. So we have to figure out how we can get that done. And the other thing, like I said before, is buying into what they want. Whether it can't be, okay, you know, I have parents coming, they have to get straight A's, go to school, 100 hours a week, take tutoring. The kid's saying, I want to never go to school and do video games. I work on a mediation program. What does a kid want? What does a parent want? We got to come to a concept, mediation, a contract, how we can work this. And it's usually pretty black and white. But the gist of it is, at 15, you don't get the choice to not go to school. It's illegal.
Yeah.
Your parents, I've had to come to the place where parents, I cannot do this. It's against the law. Child protection can be called, and the truant officer comes in. That's a hard consequence, but that 15-year-old can't make the choice not to go to school at that age. So, this is where parents sometimes, I think, forget, and we're so in a fear base, which I absolutely validate and understand. I talk suicide all day, and there's a lot of tools and I encourage them to call the crisis line. We're free. We do the assessment. We'll provide the tools for the suicide assessment and some options that you have. It's not up to the child. When you say, oh, you're feeling suicidal, what is it that you need? Because they may not even know. There's pretty straight protocols in place for that. So when you're coming as a place from a parent, which I absolutely understand with fear, we tend to tiptoe and back off and whatever you need. And that's truly not effective for the child either. It's scary for them to know you can't figure out how to do this. They don't have the cognitive awareness to say that, and they might think it's great at the time, but I've worked with kids into adulthood that I've worked with as children that were violent and aggressive. And they've said to me, do you know how scary it was that I could manipulate every single adult around me with fear? They didn't know that at 14, but this one girl I stayed with from residential treatment through 28, that's terrifying.
Yeah. So it's scary to know that you can scare your parents into a place where they become incapacitated, immobilized, and overwhelmed themselves. We need the parents to stay strong and firm without getting completely so fearful themselves that they become unable to hold significant boundaries that their kids may say they don't want, but that they do want and that they need.
And they'll never be able to say that. I don't think any of us as teenagers are, but it is very scary if you're saying I'm suicidal or you're feeling that way, to look at the fear around you and know that because any kid's going to be like, well, I can kind of get what I want if I say this. But also scary if it's true and it's inside and it's all of that. That's terrifying to think you don't have me. And I'm not faulting parents. It's a terrifying place to be. I've done it for a long, long time as a professional, so I'm very comfortable with it. But that's why I would reach out for professional support at that time. It's always a third person do the assessment. We're a free crisis line. We're lucky to have it in Colorado, but Lifeline is the other one. Reach out to someone and have that third party do that objective, so you're not put in that place as a parent. We can provide you tools to navigate in your daily life, but I understand both sides of it, I guess you could say.
Yeah, absolutely. And so, Melissa, when you recommend reaching out to professionals that can manage this and address it, Jasmine, I'm going to swing back to you for a minute, because one of the questions I wanted to ask you is, when you're identifying parenting out of fear, how do you help families and parents and identify that they are parenting out of fear, and then how do you help them make an adjustment to get out of fear?
Yeah, this is a big one because, again, it's something I think we've all sort of said, all the panelists, is parents, this is coming from a good place, right? The behaviors that we're doing, the actions we're taking, the choices we're making are with the intention of helping our kids. And I think one way to recognize, first of all, to be aware of and recognize that you might be parenting out of fear. When that happens, it's the idea of setting a limit or saying no or following through with an expectation creates a really uncomfortable feeling within yourself. It might be anxiety or fear or sadness, or just this really uncomfortable feeling. And parents have to be aware of that for themselves. And then what happens is that we then, as parents, take an action that alleviates the discomfort. And in the way that I work with parents is to help them understand that although your intentions for your child are very good, look at how you're alleviating your own discomfort when you don't say no, when you don't follow through with that consequence. You say it and you have the good intentions, but then the teen does the thing and you don't actually follow through with the consequence. Another way I see when you're parenting out of fear is actually overgiving too, right? Buying things for the child, thinking this is going to motivate them. Or the teen says, well, if I get this, can I earn this? And they never follow through with their part of the agreement, and you end up following through and buying or giving, whatever the coveted item is. So that's another way I see it. It looks positive, but it's actually coming out of a fear place.
Yeah.
Yeah. And I think the first step really is just to check in, for parents to check in with themselves. What is going on for me? What do I imagine is going to be the worst case scenario if I say no, if I do this particular action, or if I set this expectation? I find in my work with parents, we are usually able to get back to the parent can identify something in their own childhood or their own upbringing or their own, like how they were, parenting was modeled for them, what they were given or not given, for example. One example would be, my parents didn't pay, there was no talking about feelings. Nobody gave me what I needed. I didn't get this or I didn't get that. And now they're overcompensating for their child by giving everything. I'm gonna make sure my child gets what they need. When they ask me for something, they're gonna get it. And part of the work is separating out okay, what's your stuff, right? What's you alleviating your fear? What's you parent, like kind of taking care of your own inner child? And then how is that different from what your child is experiencing right now? How is this different? Because your teen isn't you at that age. One of the ways I talk about it too with parents is, look how lucky your child is to have you as a parent. That you're here with me, you're in therapy, you're doing this or doing that, involved in their school, willing to play music with them or willing to do all these things. How lucky they are to have you as a parent. And I think helping the parent also identify their self-care, right? How are you taking care of yourself? What are you doing for yourself? Where are you getting support? And in an interesting way, it kind of parallels what we want the teen to be able to do eventually for themselves as well, as take care of themselves and navigate and problem solve. The parent has to be able to do that for themselves as well before they can model it in the relationship there.
Right. I so much appreciate what you're saying, because one of the scariest things I see here for our girls is not so much are they scared and fearful of their own struggles, but they're scared that they're bringing their parents down with them. And when you have parents and kids who are both clinging on to a life preserver, and that child is scared that they're going to drown that parent in the process, it's not only is it unfair to the child, but it exasperates significantly their self-worth, what their parents can handle from them and about them, and that they are too much for their parents to handle. And I think that can get really incredibly scary. So parents doing their own work, being conscious of their own history and what's going on for them, what's getting triggered in all of these processes and raising our kids. I think one of the biggest gifts that we can give them and model them is that in spite of what you're going through, I'm still going to be okay. And I think that that's really, really a critical message of holding a hierarchy position with our kids, of saying, wherever you go, I can be there with you, but I'm not going to go down in the process, and that you can still hold on to me and feel secure in that process. And that is really incredibly important, because they need us. They need us. And I know that they say that they don't. And I know in child development, they can say, I don't need you and I hate you and get out of my room and you're the worst mom or dad in the world and I never want to talk to you again. But we need to read between the lines on that a lot, I think. So I'm really glad that you brought that up. Ashley, I'm going to circle back to you for a minute. I'm very cognizant of time here. It's about 12:18. Very quickly, we talked about, and I agree with the fact that most of the times that our kids don't want to feel this badly, that they don't want to be in this position. Can you help us when parents have this gut feeling or inclination that their kids are using anxiety or depression to manipulate a process or get out of doing something that they want to do, and using, I hate to use the word because I don't want to underestimate the significance of depression and anxiety, but when do you know when it comes to a point where they're using that emotion or feeling of depression or anxiety to a place where they're manipulating their parents, and the parents, how does a parent know when to call that out, I guess is my question.
Yeah, and it's challenging and it's nuanced, right? And one of my mentors in the field, we work together, I still see her on the fact that there's even like the tiniest grain of salt of truth to everything, right? And so similar to what really everybody has said, that there are some expectations, right? And so when the anxiety or depression or the symptom or indicator is being used as a reason to do something or not do something, then I continue to suggest check-ins, right? You know, similar to what I said before about like, we have these things that do have to get done. And I validate that you're feeling this way, but then also having like a real talk moment, right? Similar to, I really like the way Melissa frames a lot of these things of, but if your depression or anxiety or self-esteem or X, Y, and Z is inhibiting you from carrying out these certain tasks, then I feel concerned and I want to help you, right? So, and then sort of how they would respond to that. Because sometimes when you, right, when suicide is said, I don't want to do this, I just want to die, or I want to kill myself. That would be, I sort of see in a couple ways. One is sometimes they just don't know how to describe this terrible feeling and they really do feel bad and they don't have the words for it and they don't have the coping skills for it. So that's just an easier thing to say, right? So, okay, let's figure out what you're feeling and let's figure out how you can move through. But then if they continue to assert, no, I'm really suicidal. And if we give a 1 to 5 scale and it's a 4 or it's a 5, well, then we need to go to the hospital, right? Then this is no longer safe, right? And so then someone's like, oh, okay, then I'm not. But then if they really are, then you have had that conversation with them, right? And you haven't shied away from the scary topic, right? Sometimes they say these things to push away, right? Because they don't want to bring you down, right? But if you are open about these conversations, these really hard topics, then, you know, if they say, no, I'm not suicidal all of these times, the one time they are, they know they can talk to you about it, right? So then similar, coming back to the initial question of, no, I'm too anxious to go to the neighbor to get the thing they borrowed, or I'm too depressed to do the dishes. Okay, if that's true, then I really want to help you. And so then here are your choices, right? We can call this person, we can do this, we can do this. And then if they're like, oh, I don't really want to do any of those things, so maybe I'm just going to do the dishes. But if they really are so depressed that they cannot do the dishes and you have calmly offered them resources, whether they have attitude with it or not, they're going to appreciate it because they do want to feel better, right? And obviously it's never so cut and dry. And then, like a lot of people have said, once you're done with this and you have some moment to yourself, then you can practice your own coping skills about how scary this or frustrating this can be, but continuing to be a grounding presence for your child, or even saying, yeah, you know what? The other day I was feeling really sad because of the pandemic or because of something, and tell them how you went through it, right? I had these things to get done, so I got it done, but then I was able to watch a movie that made me feel better. I was able to call a friend or get a coffee. So then also modeling that it's okay and it's human and we're gonna be okay, but I need to know, is this really something that's preventing you from living your functional life, or do we just need some vocabulary?
Right, right.
Just want to say one thing that helps identify really quick on the suicide piece. When I say to kids, and when they're it's usually when they're younger, die, you realize you'll never see your mom again, you'll never see your dog again, you'll never eat again, you'll never, there's no coming back to it. Or are you so unhappy where you're at right now, you just can't stand to be in that place? And a lot of times they're like, I'll never see, they don't really get it, you know? So identifying that can be, for a young kid, can be helpful, because we've all been there where you just can't stand to be in your space, and then you can move on from that. I'm just saying sometimes that helps identify, do you really want to end your entire life? And that may seem to be direct, but it needs to be. Or you're just so unhappy right now, that's the only thing you can think of to get you out of here.
Yeah. So it's about 12:25. Here's what I'm going to do for the last 5 minutes, because I do want to open it up to some conversation. So I'm going to put all of you lovely, smart, intellectual, spontaneous panelists on the spot. If you could leave the seminar, the attendees with one quick piece of advice on enablement and versus support and or I was going to open up a little bit about consequences, but I don't think that we have time. So Melissa, I'm going to start with you. If you could have a send-off message in about 15 seconds or less of something that in your history, in your work, that you want people to know about how they can best work with their child who is really struggling with depression and anxiety, what can they do?
Validate, empower, empathize, and give choices. But don't take away the behavior or the consequence that you're working with, because that's not helpful.
Jasmine. No, Melissa, please finish. Go ahead.
I said, reach out as a parent if there's a fear base in there, or reach out for support, parenting classes, encouraging that conversation, but validate, empathize, empower, and make choices.
Excellent. Jasmine, how about you?
Well, I wholeheartedly agree with everything Melissa said. That's great. I think that's a great place to start. I came across I'm going to butcher the quote, but I don't even remember really where I got it from, if it was from a book or from a show, but I think a reminder that boundaries are a form of love for ourselves and love for our children is something something to remember. Mm-hmm. It's just as loving of an act as giving them what they want, is to say no, because it creates trust and safety in the relationship. Yeah.
Can I just piggyback? Is that okay?
Of course.
I think with the boundary conversation, if you're setting boundaries and your teen, or really anybody, are pushing back on those boundaries and getting upset because of the boundaries, that shows that they need boundaries, right? So that shows that you're doing the right thing and setting the boundaries. And then what I would also add in this last tidbit is to, with all of this, focus on your compassion, on their compassion, and being curious, and then just where's the humanity in this, right? You're working with your human, you're a human, and we're not perfect, but just leading with love and compassion.
The good enough parent.
Yes, the good enough, never perfect.
Right. Marlys.
Yeah. Oh man, I'm the ender. I feel like I need to.
A lot of pressure.
The closer.
I wholeheartedly agree with everything that has been said. And I think the last piece I want to add is just one, doing your best to really be in touch with like how you're feeling and seeing how you can use that to relate to how they're feeling. Most of the time, whether it's the explosion or the I won't talk to you, is this expression piece. So if you can let go of the I have to win and just really focus on how do we help each other express what's going on right now in a calm, loving way, then you'll get somewhere. But when we're just yelling and fighting back, we're not going to get anywhere, because they're going to shrink in, they're going to shrink in, they're going to shrink in, or they're going to explode and push you away. And so just really, like, if I don't know what they're going through because they can't talk, well, what am I going through? Like, I'm feeling scared for them. Hey, are you feeling scared? When I feel scared, this is what I do. Giving them the words, because they don't have the words most of the time. That's why you're seeing this. So that expression piece would be the last thing I'd leave with.
Well, you really pulled that weight at the end there. So I really appreciate it. That was amazing. Thank you. Emily, I'm going to hand it back to you. What is happening in that chat, and how can we help support any of the attendees?
I'm sorry, I was just reading as they were coming through. There was a question earlier that was pretty general, so I don't know if we have time to quickly focus on that. There's no other questions though. One of the general questions early on was, how do you support a kid who decides that they don't want support any longer? And I know this might re-jump into things, and just to be cognizant of time as we answer this one.
So I'm just going to say it really quickly, and you can give me a thumbs up or a thumbs down. If your kid is refusing treatment and your kid is saying that they don't want to go and they don't need to go, and you feel they do need to go, then you should go. So you go with your partner, with your family, with your other sibling or children or whomever it may be, but if your kid won't go, then my recommendation here is that you go. And so you can get advice and direction from that therapist to help navigate the waters, even if your kid is not in the same room with you.
Can I add a little something?
Of course.
I think sometimes what happens with teens, or really anybody that's like, I don't want support, I don't want help, I don't need it. It's often because they don't think it's going to help, that they're in this permanent position, right? And so I think that's great suggestion is, okay, well, until you're ready, I'm going to go and I'm going to get this started. It might be about finding the right therapist, right? It's not like you're going to vibe with the first person you see, or it might be other therapeutic activities, but giving yourself permission to have hope for progress. And this isn't like 10 days of antibiotics and you're good. This is going to be a commitment, and having like a real conversation. Like, I get you don't want support because maybe you don't think it's going to help, but I'll make a commitment if you make a commitment. And before long, it's going to be gradual. And you're going to look back on this time as having been a really challenging period of time. But if we commit to it together, it could help.
Yes.
And one last thing to touch on, like getting their buy-in. You know, again, you don't want support. What do you want? I want you to leave me alone. I want to be left alone. To do that, do you think you and I could go meet with someone together so we could try to get our needs met?
Yeah. And Jasmine, go ahead. Oh, sorry, Marlys. Jasmine and then Marlys, and then we can wrap it up.
Oh, no, actually, I agree with everybody, with everyone.
Oh, I thought you had your hand up.
No.
Okay, sorry, Marlys, go ahead.
Yeah, and just the last part that I would say too is for addiction, right? There's this whole other thing called Al-Anon, where all they do is teach you to focus on yourself and to detach with love. And there are relationships where, yes, sometimes the worst happens, but there are these relationships that have bloomed just because the partner or the kid or the parent or whoever went to Al-Anon, and maybe their kids' symptoms haven't changed, but they completely change and can connect to their loved one despite them still being in their chaos. So just to piggyback on what Andrea said, like so much can come from when you focus on yourself and asking for help to get through what they're going through.
Yes, I think we have this perception that we need to be all in it all the time, and sometimes maybe stepping back and working on ourselves and then coming back with a new perspective and new insight and new ways can help our child when the focus is off of them for a minute, as counterintuitive as that may seem. So thank you, everybody. Ashley, Melissa, Jasmine, Marlys, and Emily, and thank you, everybody, for being here today. Please let us know if you have any feedback about the presentation, any ideas for future webinars. And we thank you for taking the time today, and we look forward to seeing you again at another time and space. Take care.
Bye, everybody.
Thank you. Bye.
Hi, thanks for coming and taking that next step.
Yes.
Bye.
Hi.
Hi.
How do you?
Give me 1 second.
Okay.
Were we supposed to stay on?
No, that's okay.
Okay. I was like,
No.
I remember you mentioning checking in. I was like, oh, I just rushed right off. So, okay.
Wait,
Thank
Jasmine,
you so much,
you know,
Jasmine.
do you know what this reminds me of? Do you remember the movie Ferris Bueller's Day Off, when he came back and he's like, are you still here?
Yeah. That's how I feel right now. Yep.
Thank you.
All right. Thank you. This was great. What a great opportunity. Thank you.
Thank you so much.
Bye.
That was great. The chat, everyone was like, wow, this was so amazing. So
Awesome. And
Yep.
we can talk about it, but you know, I think one of the things that I think is that we're doing well, and I'm sure there's areas of improvement too, but people don't want to talk about it anymore. They want problem-solving strategies. And
Yep.
like so many of these webinars go over like, what's the data and how many people are struggling and blah, blah, blah. It's like, this is not what they're interested in.
yep, here's what to do with your kiddo and here's how to do it. Yep, and here's what to do as a parent. Yep,
Exactly.
agree. Well, I will get together these notes. It might take me a day or two to do that, but I'll get the recording up more quickly. quicker,
Okay.
so that we can send that out to people. Because I think if we can get that out before the notes too, that's fine. There's a couple people on here that popped off that I'm gonna send individually.
Okay.
Yeah, I think that was great. So
Okay. Thanks, Emily. You're the best.
yeah,
Talk to you
thanks,
soon.
Andrea. Okay,
Okay.
bye.